Respiratory podcast, Hello Apollo. I'm your host, Dr. Karan Thakur. Through this podcast, each week we take one big health issue and discuss it in detail with an expert. And this week is no different, and I'm delighted to welcome Dr. Nikhil Modi, Senior Consultant Respiratory Medicine at Indraprastha Apollo Hospitals. Dr. Nikhil, welcome to the podcast.
Thanks, Dr. Karan. Thanks for this invitation.
And it's always wonderful to have you to get your insights. And this week is no different, as I said. And we're discussing a very serious subject, and that is air pollution. As you would know, and our listeners know, the air in Delhi and in the entire north of India has gone very poor. There are lots of reasons for it. A lot of it is man-made, a lot of it is weather-related and geographic. But whatever it is terrible. Schools are closed, and it is causing impact on our health. And I want to discuss this in greater detail with you. Many of our listeners would know Dr. Nikhil was one of our front face for COVID-19, and he's been leading the charge through various waves of COVID. But he's also a specialist on respiratory distress and respiratory illnesses. So no better person to discuss this subject than Dr. Nikhil Modi. So Dr. Nikhil, I'll start with the first and foremost question, which is, what is the impact of poor air on our health?
Yeah. So even before COVID struck us, I think for last 10 years, the air quality in Delhi or NCR, even if we say north of India, has been very poor. And so the impact has been so much that you can say that WHO has labeled Delhi as the most polluted city in the world. And the air quality index, which should be less than 50, we are never below 400, 500, especially during this time of the year. And now when we inhale this air all the time, what it is doing, it is just not causing diseases of the airways or the lungs. These particulate matters are so small that they can even traverse through into the blood vessels, and through the blood can go into any part of our body and cause illnesses anywhere. So to start with, if I say that initial symptoms may be just a runny nose, sneezing, cough, and then breathing difficulty, obviously when the lungs are involved, but it may give rise to illnesses as big as a lung cancer. Once this particulate matter goes into the blood vessels, it can block them and can lead to heart attack, stroke. And there is a data which suggests that the current air which we are breathing is reducing our life expectancy by 3.5 years already. And if we say in coming generation, this life expectancy may go down further.
Right. So yeah, I mean, this paints a very worrying picture. As you said, this is not something recent. We've had poor air for the past 10 years, but there is a seasonality to it. We do have some better air. So does this time of the year become more critical for us, or should we be worried about air pollution throughout the year?
Actually, we should be worried about air pollution throughout the year, because even when we are saying that we are having a better air, but it never meets the criteria which has been laid out world over.
Right.
So we have to be cautious all the year round, but definitely this time of the year, it's more. There are multiple factors to it, because the winters, the wind speed reduces. So the cold air doesn't move fast. That leads, so wind is not moving, so the pollutants gets collected at a specific place for more time. That's why the pollution levels are higher at this point of time. Further, there are additional factors which occur at this time, which we call as parali burning, which is there. But to be very frank, it is just a small component. Only 15 to 20% of the actual pollution is caused due to parali. And rest of the factors like the industries, our automobiles, which are present throughout the year round, are the more important factors still. Definitely due to lack of wind movement, the pollutants get collected more, leading to smog formation, which is more harmful.
Right. And you briefly touched upon it, but for the benefit of our listeners, what are some of the symptoms that indicate that, air pollution might be causing some damage to your health?
Yeah. So the first things we can actually divide the problems which we face due to this as acute problems, which we see every time when this season comes up, which most commonly is irritation in eyes, watering of eyes, sneezing, nose block, runny nose, constant throat irritation, a constant provoked cough, asthma-like symptoms, especially in elderly or children, leading to breathing difficulty, wheezing or in the chest. You become more prone to develop infections, pneumonias this time of the year. The normal viral mild may take a severe form at this point of time. So these are the acute things which we face each year round. And obviously, due to each year, we are getting exposed to so much of pollution. So on long-term basis, you can have diseases like COPD, which is a permanent damage to your airways, lung cancer, as I've already told, and even stroke, heart attacks are a common thing to occur due to this.
Right. And, we always speak about the impact on vulnerable populations. First, I think it's important if you could tell our listeners who are vulnerable and how does this impact the vulnerable
then? Presently, the pollution level which are there, you can equate it to be equivalent to smoking almost 30 cigarettes a day. So actually, whole of the population is actually vulnerable right now. But definitely, two groups which I would say are most vulnerable will be children. Because firstly, children, because their airways, their lungs are still not fully developed. So they are getting exposed to this pollution at a very smaller age, and their lungs, which have to develop normally, are not able to develop due to this damage they are facing due to this. So at early age, they can face problems of breathing, COPD, which may not be seen otherwise. And this permanent damage is definitely bound to decrease their life expectancy as well. And also, elderly population is more vulnerable because with age, their airways, their lungs are getting weak day by day itself. It's a normal aging phenomena, which is hastened by exposure to so much of pollution. So the damage which may occur to a healthy middle-aged gentleman or a young adult will be slightly less, but to children and elderly, the damage may be faster and more severe.
Right. And since unfortunately India is the diabetic capital and also we have a large burden of cardiovascular disease, how does air pollution impact the health of these two categories of people?
Yeah. So a person who has diabetes is in any ways prone to more infections. So the risk of pneumonia, catching hold of tuberculosis increases further due to this air pollution. Further, these diabetics and all these patients who have other illnesses are more prone to develop heart issues, stroke and neuro issues. So that also is further worsened due to this pollution exposure.
Right. So, we've got sort of our arms around the problem and the severity of it and what it can do to you. Let's move towards some sort of solutioning or at least adaptation. In this current, the level of air pollution that we have and the air that we're breathing, if we start for the vulnerable population, let's say the older people and for children, what advice to tackle this? What is the best way to tackle air pollution?
Yeah, see, the best way to tackle, I think, will be to reduce the pollution somehow.
Yes.
But that's a very long-term thing. For the present scenario, till the pollution levels are getting controlled, I would say all those who are vulnerable to this, especially children and adults, should not be going out when the pollution is at its peak. So minimize going out in this pollution till the time it settles down. Secondly, if you have to go out, I think COVID has made us understand that the way to protect ourselves is wearing a mask. This we have been propagating for the pollution as well for a very, very long time. So wearing a mask, we now have adapted for COVID. So for protecting ourselves from pollution, wearing a mask whenever we are going out is the best thing. Right. Apart from that, a good healthy diet rich in fruits and vegetables, because they give us a lot of vitamins. They give us a lot of antioxidants and minerals, which can take care of the damage which is seen due to this air pollution. So please ensure a healthy, high vegetable rich and high fruit rich diet, so that the whatever effects can be minimized, that will be great. And also do exercise daily. A good amount of exercise, even doing yoga and all these things, go a long way in helping your body staying fit. But obviously, for the time being, mostly exercises are done in early morning or time. But for the time being, I would not recommend you going out for the exercises. Indoor exercises are safer because of the pollution. If you are planning to go out for a walk or anything, then try to go in afternoon when the sun is at its peak, the pollution level are at its minimum.
Right. So, a lot of people would sort of not understand the importance of this, but you are very categorically saying that, you have to reduce exposure. So it is not safe to actually exercise right now in the early hours or late at night when the pollution may be at the highest. Is that correct?
Yes.
Right.
Definitely.
So that is an important thing that I think is a take-home message. You spoke about exercise, and I think a lot of us would have just, we're starting a new year and we would have taken that resolution to get back onto some sort of an exercise regime, and then comes this bad news of air pollution and experts like yourself advising us not to go out. So in terms of indoor exercises, what is your recommendation for the general population?
Yeah, a stay or a treadmill type. Those who may even weight training also in a limited body. Yoga exercises, even these low Kapalbhati, because your lung capacity improves with that, and yoga is a very good form of exercise. All can be done. You can try all.
Right. So yoga, breathing exercises that have been prescribed, stationary bike, treadmill, and weight training if your health status allows you to, obviously under supervision or guidance, and of course you should ramp it up as Dr. Nikhil just said. I'd also like to draw your attention to a slightly allied part of the impact of air pollution, that is the relationship between air pollution and mental health. We are also seeing one that air pollution is causing distress in people, but does it have an impact on our mental well-being and mental health?
Yes, surely it does have an effect. See, whenever you are having symptoms, even if a mild cough is there, that disturbs your normal mental well-being. And now you're constantly being exposed to this higher pollution. So even if it is not directly affecting, but the stress levels which are there are definitely increasing. So indirectly also you can say, by increasing your symptoms due to which you might be having lack of sleep, because many of the patients who develop allergic cough due to this have cough at the night and they're not able to sleep properly. So when your mental health is being affected directly or indirectly due to.
Right. And if we talk about medical interventions, because a lot of patients who suffer from, like you said, COPD or asthma, what is your advice for them in terms of their regularity of medications, and what should they be doing?
First thing, definitely regularity of medicine is of utmost importance, because if they are not taking their medicines regularly, a sort of inflammation is left behind in their lungs, which makes them more prone to the damage due to this pollution. So taking your medicines on, it is a population. I will again advise, if you don't have to go work, you can avoid going out till this level, settle down, and again maintain a healthy diet and some amount of exercise to keep your lungs fit and fine.
Right. And for people who do have sort of symptoms due to exposure, like you said, watery eyes or shallow cough or whatever, any advice for them, medical, non-medical, to tackle this?
Yeah, some non-medical things which you can do at home is just taking a steam. Steam helps to clear out all the pollutants, particulate matters that might be there. So take a good amount of steam. And apart from that, taking some warm saline gargles, just lukewarm water, put some saline, do gargles with that. That helps to clear out your throat. And apart from that, ginger, honey, are spices which we have, tulsi and all. We can drink tea with tulsi and all. So these natural things which are available in India are quite a good thing to keep our airways protected from all these damages. Apart from that, I would say these are measures which may help you control milder symptoms. But if your cough is becoming troublesome, your symptoms of nose block and other symptoms are becoming troublesome, you should take advice properly from a doctor and then start the treatment as early as possible, because if it continues to worsen, the things may go out of hand and then you may require a longish type of medicine, and you may suffer from permanent damage also.
Right. And, a lot of people are now at least made aware of CPR and, first responders for various health emergencies. For the benefit of our listeners, if you do find somebody in respiratory distress, whether they have a lung condition or not, what is your advice if you were to see a person like that? How should they approach it? How can they, be of assistance to such a person?
So the CPR thing, which many people must have understood about that, is when the patient has collapsed, he's unconscious, his heart is not working, he's not able to breathe. So that is the most extreme thing. But if a patient is in distress, try to make him sit at a place, make him comfortable, keep environment clean around, do not make it crowded around him so that he can breathe properly, and immediately see for a help by asking for an ambulance to approach the area. And maybe if he's carrying some medicines for his breathing difficulty like an inhaler, then you can give the medicine immediately. That will help in relieving the patient.
Right. So we're just drawing our conversation to a close, and before we do that, I'd like to ask you about some other ways to mitigate the impact of air pollution. One is the efficacy of air purifiers. What is your general advice to people on that?
I think this is a very controversial question.
It is.
Because now with the air pollution around, there are a lot of air purifiers which have come up. And they may range from few thousands to maybe lakhs also.
Correct.
But I feel it is more of an industry-driven program.
Right.
The air purifiers, when they were actually introduced initially, they were for patients who used to have some sort of allergy due to some things which they face at their home. So they used to keep air purifiers. The allergens they were exposed to were minimized, and that would help. Definitely, air purifiers do clear out the air, but not all air purifiers are good.
Right.
You need to ensure that what type of area they are covering, because if you see an air purifier, it may be showing that it is clearing air and the air quality index may be very good, but it is at a place where the air purifier has been kept.
Right.
The other side of the room may not be that pure. First thing is that.
Right.
Secondly, the cheaper air purifiers may not have good quality purifier filters. The best filters are HEPA filters, which can even deodorize your air, but that is a costly thing, and that has to be changed very frequently.
Yeah.
And most of the air purifiers don't have that. The filters may get clogged very fast, and they may not be effective after some time, and we might be just seeing that it is working, but it may not be effective. So it's a very controversial thing. So you need to make sure that the area which the air purifier is covering does cover the room in which it has been kept, because sometimes the cheaper ones cover a smaller room only, and we keep it in a large living area or something, and then they are useless. And also, whether or not the HEPA filters or good quality filters are there in the air purifiers, only then the benefit will be that. And you should be knowing when to change the filters, when to get them cleaned. Otherwise, the very purpose of the air purifiers is defeated.
Right. So we should not be in any false pretense that just putting out an air purifier and everything is sorted. So good advice from you there, as always. And my last question is, I have come across a lot of people who are actually popping a lot of pills now, unfortunately, counter, which are actually meant for people who may have some respiratory condition or disease, and they think that this is a way to take care of it. It's pretty much like people taking painkillers or paracetamols at the drop of the hat. What are the health impacts or the downsides of such a move?
See, each and every medicine, whether it's a normal paracetamol tablet for fever, if taken unnecessary, does produce some amount of side effects. And so these respiratory medicines, especially, most of the times, in many cases, a steroid may be used in these cases. And if it is not used properly over the counter, it may cause more harm than benefit. So do go by a proper doctor's advice and don't take these medicines over the counter. Even taking normal derifylin tablets for breathing, which has been there for so long, it can cause increase in heart rate. And if it is you are a cardiac patient, it may cause heart to stop suddenly. And so it can cause tremors, it can cause cramps, and overdosing of it can cause toxicity. So this is just one example. So you should go by doctor's prescription. Please don't take these medicines over the counter because they can do more harm than benefit.
Right. Dr. Nikhil Modi, thank you so much for joining us for this episode and giving so much clarity on a range of subjects. Thanks once again, Dr. Nikhil.
My pleasure always. Thanks,
That was Dr. Nikhil Modi. And if you do want to reach out to him to get his advice or to seek an appointment, do reach out to us on our digital platforms or DM us. You can also call our landline number and book an appointment with Dr. Modi. Remember to share more information about this episode and about this podcast with all your friends and family, because good health is for everybody. Till next week, stay happy and healthy.